Hi, I'm Marjorie Cook, and I am an advocate in Summit County and a parent, and I'm going to talk about evaluation and reevaluation in special education. So our objectives will be to discover how and why a child is evaluated for special education services and learn to use the evaluation process to address skill deficits that affect a child's ability to access their education. So Child Find is a mandate through IDEA that's a legal requirement that schools find all children who have disabilities and who may be entitled to special education services. Child Find covers every child from birth to age 21. The school must evaluate any child that it knows or suspects of having a disability that interferes with them accessing their education. So Child Find is for youth in all settings: juvenile justice facilities, residential placements, charter schools, private schools, as well as public schools. So Child Find is for all youth everywhere. Typically what happens is that a student's teacher or a parent surrogate may be concerned about a student's academic work or their behavior, and they request an evaluation. And by law, the school must seriously consider this request. Now, the school doesn't have to agree to every request for an evaluation, though. If there's reason to think that a student has a disability that requires services, then the school does not have to evaluate. If there is agreement to conduct an evaluation, an initial evaluation for services would be done, and the school psychologist would work with the team to fill out a planning form with the areas to be evaluated. And this form is really a great way to keep the team members and the parents on the same page and to outline exactly what's going to be done and by whom, to get a thorough look at the students functioning in the school environment. And once the school agrees to conduct this and they get this planning form signed by the parent, who has to sign it to give permission for evaluation, the school then has 60 days to complete this initial evaluation. This planning form really is a great way to keep everybody on the same page and to make sure that we're assessing all areas. So the team would meet and talk about these different categories. The first one is information provided by parent, and that's provided by the parent. This form will let you say what the area is, what the assessment is going to be, and whether or not you have enough information, and then who's going to perform the assessment. General intelligence is typically done by the school psychologist with an IQ assessment. Academic skills are done by a school psychologist per an academic achievement assessment. Classroom-based evaluations and progress in the general ed curriculum is typically done by teachers. They'll talk about their grades and what kind of progress they're making on getting through the curriculum. And then there's data from interventions, and the intervention specialist or a teacher would talk about any interventions that were done up to this point and how the student did. And the planning form continues on with a communicative status, which is a speech and language pathologist, again, per assessment. And it's important that these areas be used by assessment so that we really have data to inform our decisions. That should be it. So a speech and language pathologist will typically come in and do an assessment or two and look at their communication needs. And again, it lists the communication status, communicative status, but it leaves it open for who's going to do the testing and what testing they're going to do. So this is where you would want to make sure that they put down a speech and language pathologist and that they put down that they're going to do assessments. Vision, oftentimes we see a past screening there, or if there is a concern, get an optometrist to come in and do some kind of a screening or a vision test. Same thing with hearing, audiologist if there's a concern. Social emotional status, and I think that's an area where a lot of our kids, our multi-system kids, need an assessment. A school psych will often do that. There are several different assessments that are done that can look at a child's social emotional status. And it's important that that not get overlooked. And it's not required that it be done. It's on the planning form and the team agrees to it. So make sure that that social emotional status is looked at by someone who can do an assessment and really look at it. Often the assessments will have a piece that's done by the parents, a piece that's done, if they're in a placement, a piece that's done by the staff there, or a piece that's done by the teacher, so that you're getting a good look at the child's status in different areas. A physical exam and general health, typically a child's pediatrician has done some kind of a physical, and that can often just step in and you can use that. Sometimes there is some kind of a physical exam or general health concern, and you may want to look at more information there. Gross motor, a physical therapist, again, per assessment. I like to stress the per assessment piece so that you're really getting a look at that child's functioning for their age, and you can get a look of where they're at. Sometimes I've seen phys ed teachers or parents that have a concern that maybe the child can't skip or can't go upstairs properly, and they might be the one to kind of red flag for this, that there's a concern that needs assessment. Fine motor, again, an occupational therapist per assessment. And you're going to look at things like, not just can they write, can they hold a pencil, but things like, can they button their pants and button a shirt, or can they get their pants up and down? Can they, what can't they do? What are they struggling with? Vocational and transition, that's to be determined. Where you see a concern, ask for an expert to come in. Don't rely on, the general ed teacher to step in and say, oh, well, I can talk about vocation. They probably really have the concern for the student and what their vocation might look like, but they probably really don't have the background to give a true evaluation. Most schools do have somebody on their team who is a vocational expert who talks with the other professionals on a team about how to transition a student into some kind of a vocation. Try to get that person. And don't forget that piece for our kiddos that are deep in the system and have a lot of special needs or have a lot of behaviors that get in the way. They have the right to have a vocational transition plan and an evaluation that looks at how they're going to be prepared for post-secondary education or for their life after they graduate. Background history, typically the school psychologists and parents provide that information. It can be information from birth, from, even from pregnancy and on. If there are any concerns, that's usually shared in that area. Observations, the school psychologists and the teachers or a behavior specialist will usually come in and observe a student and make some observations and share that with the team. A behavior assessment. Again, a school psychologist or a behavior specialist is probably going to be your best bet to have some type of a formal assessment done so that we're really looking at that kiddo's behavior in school and how it's affecting them accessing their education. Oftentimes schools don't do this automatically for behavior, even for kids with behavior challenges. So make sure that you get something checked in that box and you have a clear understanding of what they're going to do. Adaptive behavior, again, a lot of our kiddos that are system of care kiddos that are deep in have some adaptive behavior concerns, and a school psychologist should take a look at that. Or you could even have somebody like O'Calley come in, or somebody who, really is an expert at looking at some adaptive behavior pieces. There's a spot for Braille needs, audiological needs,
assistive technology. If we have kiddos that, you know, aren't communicating by using their words, they may use some type of a device or some type of card system. Again, find the expert in your district or in your in the educational service center that really understands assistive technology and can do a full assessment and evaluate where that child is with a communication device. And then the last box is other. And I love that because when I first started doing this type of work, there wasn't even a planning form. So now not only do we have the planning form that really helps inform the team, but we also have a box that says other, which makes it clear to parents and other team members that you can look at anything else that you determine as a team needs to be looked at. And some examples include a functional behavior assessment, a sensory processing assessment, sign language assessments, mobility assessments, and one that I don't see nearly often enough for our kids that oftentimes are accused of being a threat to the school environment, a threat assessment. And this is an area to really look at these other areas that can really inform this team of, you know, is this kid really a threat, or does this kid need some sign language to be taught, or is he right? Is he or she really at the point in their communication that this is a great fit for them? I wouldn't know that as a parent. A teacher's not going to know that. But in this other box, we can mark it and we can find the right person to do an assessment and look at that. So make sure that you take a look at this planning form, that it's filled out, that it's signed, and remember that the signature by the parent or the surrogate parent starts that 60-day timeline. So the team convenes to review the ETR after the 60 days, the evaluation team report, and they use that to determine if a child's disability would qualify him for an IEP. And there are 13 different categories under IDEA of educational disability, and each category has their own eligibility definition and criteria. And you can look that up online. And oftentimes we might assess for 2 or 3 different areas that we're not sure. Sometimes we might assess for autism. We might assess for some type of an intellectual disability. We might assess for a learning disability and another health impairment because we're not sure which of those categories the kiddo might fall under. So we look at all of them and make sure that we assess all areas that would give us a look if they would meet the eligibility definition and criteria for those different categories. So if they're found eligible, the team would create an IEP, and then they would have 30 days to do that from the day that they're found eligible. But if they're not found eligible, they may discuss other interventions, or they may agree that the child doesn't need any interventions at this time. But if the parent or the parent surrogate disagrees and says, okay, school district, I hear you, and I hear the team say that the student, my child does not need an IEP, and you disagree, you have the right to request an independent educational evaluation, which you don't have to state why you disagree. Oftentimes I see school districts will ask a parent doesn't know what to say, so because they can't put the words together or they don't have the understanding enough to list what they disagree with, they kind of get intimidated, they back down, they retract their request for an independent educational evaluation, and the whole thing kind of gets dropped. So I want to make it very clear that they do not have to state why they disagree, and it even says that on the form where they sign that they don't have to, but it's, you know, in tiny print, and sometimes you don't read that or you don't see that. But as an advocate, I've had to speak up many times at a meeting to remind the school district that the parent does not have to give a reason why they disagree. All they have to do is disagree and request an independent educational evaluation. The independent educational evaluation is done at the school's expense, so the school has to pay for it. It's not an option. They also have to provide the parents with a list of potential examiners, and the parents and the school district need to agree on who they're going to use. Once that evaluation is done, all that's required of the school district is that they consider the results. So I have been in meetings where they've considered the results and determined that the student still does not need anything extra, even when the results clearly stated that they did, and even when there were clearly recommendations for an IEP or recommendations for interventions, schools can still say no, because again, they're only required to consider it. The team should consider the recommendations, and they should work to incorporate any recommendations into some type of an intervention plan, whether that's an IEP, a 504, some type of intervention. But if the school maintains that the evaluation does not support an IEP, as an advocate, I encourage the parents to ask the school to continue to monitor those areas of concern. And then I talk to the parents about filing a complaint if they feel strongly enough. There is an option for them to file a complaint stating that they believe that their child does have needs and they believe that they have documentation through the evaluation process that supports it, and that the school is refusing to provide them their FAPE, their free and appropriate public education. Because if they really do need these supports and they're not getting them, it is a denial of FAPE. Typically, by the time we would file a complaint, and I've only had to file a handful of them in a dozen or more years, typically the school resolves the issue before it even gets to that point. So then there are reevaluations. So after you get your initial evaluation and you have an IEP, there's a requirement that every 3 years you're reevaluated to determine if you're still eligible to receive services as a child with a disability. Sometimes I see school districts say, well, clearly this kiddo still qualifies. We don't really need to, spend our time reassessing, reevaluating. We can just go ahead and do a record review and move forward. I strongly encourage parents not to do that. It's really great information if you can get some data that can really tell the story of where this kid is 3 years from the initial evaluation. You can understand any progress that's been made. You can maybe look at any new areas that are of concern that maybe weren't of concern 3 years ago. It's a great way to compare where a child was, where a child is, and make sure that you're addressing all of the current needs. So the data really tells the story, and data speaks for itself. Don't leave yourself without the data. Sometimes a team could determine that they want to evaluate after 1 or 2 years. They don't want to wait the full 3 years. Typically, I see that happen when a kiddo is maybe going to move into high school, and maybe they're not due for an evaluation for another year, but they're making a move, or they've seen a big jump in either their skill set, or maybe there's been a decrease in their skill set, and you want to really get a good look at where this kiddo is now. Sometimes I see that happen when they go to a placement. After they've been to a placement, we determine that, well, let's go ahead and do another assessment now where the kiddo's in a place where we can really get a good look and they're cooperating and that we can get what we need from an evaluation. So there are lots of reasons that a team may determine that they want to reevaluate after 1 or 2 years instead of waiting for the 3 years. And don't forget that, kids grow, they learn new skills. They, every year children are changing and growing and developing new skills that are developmentally appropriate. And it may not have even been on the radar 3 years ago. It is on the radar now because it's now age appropriate. And that's my presentation on evaluations and reevaluations. Thank you so much.
Thank you so much, Mark.